Welcome everyone. My name is Gillian Sarant. I am a Work Health and Safety Client Manager within the People Risk team, and together with my colleague Stephen Dowling, we're going to take you through the steps needed to co-design and deliver an integrated mental health strategy. First, we need to know, what does a mentally healthy workplace look like? In a mentally healthy workplace, managers and teams understand mental health and openly talk about it. People know about things they can do to build resilience for challenging times at work and at home. Staff with mental health concerns seek help early, and staff with mental health issues are supported in their recovery. So knowing that gives us our why. Why do we want to build a business case for change so that we can develop a mentally healthy workplace? We also need to understand the key elements of better practice mental health strategy, and we'll talk ourselves through that one. We'll also outline the critical success factors to implementing your mental health strategies. So how do we support people in the workplace to get well, manage illness through getting well, stay well by preventing harm, and be the best they can be by promoting the positive at work. We'll highlight what success looks like from an organisational, an operational team and an employee's perspective. When we're developing these strategies, we need to consider the following organisational risks. To start with, we have compliance. Work health and safety legislation applies to mental health in the workplace. Industrial manslaughter has changed in ACT, Queensland and Victoria, with higher standards and organisational and personal accountability. We're also going to consider financial and service delivery. Improved wellbeing outcomes at the individual level can have a positive impact on your organisation's bottom line. For every dollar spent on effective mental health action returns $2.30 in benefits to the organisation. What about reputation? Developing a strong mental health and wellbeing strategy can enable organisations to become employers of choice. A recent Australian CSIRO study found that 91% of surveyed employees believe that mental health in the workplace is important. Furthermore, a mentally healthy workplace was the second most important factor in the employee's decision to accept a new position. We also consider workers' compensation. On average, 7,820 Australian employees are compensated for work-related mental disorders. When looking at all overall workers' compensation claims, that's attributable for 6% of workers' compensation claims because of mental health disorders. Focusing on building a mentally healthy workplace decreases workers' compensation claims. We also consider ill health, where we already know approximately 20% of Australian adults will experience a mental illness per year. KPMG estimate that Australian employers could save an estimated $0.5 billion if 5% of individuals in each category of mid, moderate and severe mental illnesses were able to reduce the severity of their mental health issues as a result of supportive workplace environment. What about engagement? Engaged employees are willing to go above and beyond to aid in the success of the organisation. There are a range of factors that organisations can use to drive employee engagement, and prioritisation of wellbeing is one of them. When it comes to productivity, it can be impacted when employees are experiencing mental health and wellbeing issues. In Australia, mental health disorders result in lost productivity to organisations of $10.9 billion per year, and that made up of three components: workers' compensation, which we have already mentioned, presenteeism and absenteeism. Presenteeism is when a worker comes to work and cannot fulfil the requirements of their job because of untreated mental illness, and it's by far the largest component of these three that make up that 10.9 billion reduction in productivity. On top of that, we have absenteeism. Employees who consider the workplace mentally healthy are almost 4 times less likely to say they have taken time off work due to being mentally unwell in the past year compared to those who work within a mentally unhealthy workplace. We already know that if a worker is away from the workplace for greater than 14 weeks, we have less likelihood of getting them back into the workplace, and sometimes less likelihood of ever getting them back into the workplace. And the average time taken off for a person with a mental health disorder is 15 weeks. Mental illness is now the leading cause of sickness, absence and long-term work incapacity in Australia. And prudent organisations are preparing their mental health strategies to control for the fallout of poor mental health and wellbeing as a result of employees living and working through the coronavirus pandemic. A recent Black Dog Institute mental health and wellbeing survey of over 6,000 Australian workers has highlighted that most people were more worried about their loved ones contracting COVID-19 than themselves. However, 78% of them reported worse mental health since the outbreak began. And the factors that impact mental health and wellbeing are complicated. Work-related factors, including role design, maybe demands and control, team and group relationships, support from colleagues and managers, and organisational change, recognition and reward, psychological safety, climate and physical environments, also combined with an individual's conflicting home and work demands, significant life events, as well as their individual biological, psychological and social risk factors, all contribute to mental health and wellbeing outcomes. What we can control is the role design, teamwork group factors and organisational factors that we can hopefully put together a strategy that will make those things into protective factors for our workers instead of contributing to potential risk factors to developing psychological injury. And how we do that is by having an integrated approach. So in our development of the mental health and wellbeing strategy, and it'll be based on evidence-based research. The integrated approach has 3 key elements actioned simultaneously. We want to prevent work-related harm, and we want to promote the positive aspects of work and we want to manage mental illness as it manifests in the workplace. So that will look like managing mental illness could be reasonable adjustments for people who are coming back into the organisation after a period of time off, or developing a psychological return to work similar to a physical return to work that is based on the actual symptoms that person is experiencing. Promoting the positive could be awareness programs, promoting your EAP providers, promoting through training sessions such as Healthy Minds at Work or Mental Health First Aid. And prevention of harm is going through your policies and procedures and ensuring that they don't contribute to psychological injuries in the workplace. I'm going to hand you over to my colleague Stephen now, who will take you through the how of co-designing and implementing mental health strategies.
Thanks, Gillian. Let's focus on each of those 3 priorities, and let's focus on the first one, priorities for preventing harm. The knowledge and skills of people on mental health issues at all levels is really important in your workplace. Developing knowledge and of psychological risk and psychological health is really important. Creating education programs that implement workplace programs that address specific risk factors. If you're downsizing your workforce, if people have had their incomes or hours cut and it's creating psychological harm for those across the workforce, focus on building in issues around financial management or other risk factors that may occur, either geographically, if they're fly-in, fly-out workers, or whether they're continuous shift workers and the issues that focus from those. Develop education programs that focus on the risk factors that could be specific to your work environment. And above all, build employer resilience. Implement programs that are aimed at building employee resilience, in building coping skills for the issues that they may face as work moves forward, as projects start up, as work progresses and production levels increase, or as projects or production levels wind down. Build in that resilience and to manage and adapt to that level of change across the organisation. The second element is promoting the positive of work at work. Really important for you to have sound, supportive HR and work health and safety policies that promote mental health and wellbeing and promote fairness and remove discrimination and stigma for those that may suffer ill health at work. It's important that leaders, particularly leaders watching this program, to promote and market the EAP and other staff welfare services that you have. EAPs have been around since the late 80s, since the stock market crash of 1987. One of the challenges that people hear is when you say EAP is employee assistance. It's almost like a general put down of workers. Use a few more words to promote EAP. The way I describe it is skilled clinicians that are available 24/7 to respond to a worker or an immediate family members, any of their health concerns. They're available 24/7. They'll offer a non-judgmental, professional, confidential response to those health concerns, and they're available 24/7 and it's free. Use a few more words to promote those staff welfare services that you have across your organisation. Better practices in response to critical events. If issues do surface across the way, it's important to respond to those issues to reduce the risk of psychological risk to those that may have been impacted or affected by those critical events, whether it be an issue of workplace fatality or an issue relating to significant harm that may have impacted many or some across your workplace. And above all, continuous improvement of risk reduction. Build into the accountabilities of those accountable for mental health concerns and issues, work and health safety professionals, HR professionals, an accountability to review the factors that contribute to mental health problems as part of their normal risk assessment and control processes. Thirdly, priorities for managing illness. Supporting people that have mental health needs is really important. We've spoken about those supportive policies that need to be in place. At times, you may have to call for independent medical examinations where appropriate with occupational physicians to ensure that treatment plans and responses are appropriate for the needs of the individual and the needs of the team. Activating early intervention systems, really important for both work-related and non-work-related illness and injuries that may occur in your workplace. Don't be afraid to build in those early intervention systems that you have for work-related issues into non-work-related issues. If there's an event, the systems are activated early, and the earlier the intervention, the better the risk management and the better the outcomes for the individual. Review your compliance. For all future work and rehabilitation procedures, it's important that they're assessed, and use medical health assessments if and when needed. And I think it's important for those that are on safe early return to work programs that you put in place routine support for monitoring mental illness, and that any reasonable adjustments are monitored as part of the stay at work or return to work programs that you put in place. So, what are the critical success factors that can really give you a standout in terms of your mental health strategy? Adopt an action learning approach. You learn by doing, and it's a continual journey, as physical safety was a continual learning journey across your organisation. You need to build a platform for meaningful change, and one that's really valued by all. Commit to the co-design, consultation, implementation and monitoring and continuous improvement cycle around mental health strategies as you would anything else. Don't make it too complicated. Simply simplify it. Stay focused and avoid the mental health strategy that gets put in a folder or put in the cloud and forgotten about. And I think above all, lead it. The task is not just to write a strategy paper around mental health strategy. The task is to enrol people in the wellbeing strategies that where they can make informed decisions and informed choices around their health and wellbeing. Measure it. We know what measures get done. Mental health strategies must become part of the operational plan and that guide accountability and activity as any other measure would, as any other strategy would. And I think own it. Mental health strategy initiatives must be owned by a champion. They must be a person that's accountable. That is, given the requisite authority to put in place the effective implementation of what that initiative is. What happens in organisations? We share accountabilities. And if you share an accountability across two people, it doesn't double the accountability, it halves it. And if you don't provide an accountability for initiative, evidence shows us that the opportunity peters out. It's another idea that never translated to practical action. So appoint a champion where possible around these initiatives and give them the support that they need to take idea to action with others. And above all, live it. As time goes by, the mental health strategy, and as you roll it out, you'll get new insights. Your business environment will change. Don't be afraid to change your strategy to be responsive to the needs of others and to the needs of your workforce. In terms of delivering better practice strategy, there's many delivery solutions that are now available. Many of them are on smartphones and available to geographically spread members of the workforce. Don't be afraid to put together a blended system of service delivery that provides scalable solutions to your workforce, digital solutions, those that stream through to their smartphones, online training solutions that they can access by computer or smartphone, and above all, face-to-face training solutions that provide not only the training but the ongoing coaching on the job to benefit individuals, learn new skills, learn new ways, and stretch into the complexity of the issues that they may face across their work teams, divisions, and business units. So, what does success look like? It's important that you know what success looks like, as Gillian said, before you start on this journey of developing an integrated workplace wellbeing and mental health strategy. For your organisation, it's investment. It's demonstrating due diligence to manage safety and mental health and wellbeing as you would any other accountability in your business. It's utilising and reviewing the materials and the programs that you've got in place that may be fragmented. It's developing better practice, evidence-based programs that really deliver value to you, your operational sites, and your employees. It's wellbeing being integrated into the policy framework and not being seen as something else that needs to be added on, something else that just needs to be managed. And an awareness of mental health risk factors across your organisation so you can stay ahead, partnering with better practice organisations or even research teams like ours to always be focusing on continuous improvement and what next. For your operational sites, what will they see? Operational management commitment to be able to promote, to be able to prevent, be able to implement and support the continuous learning of mental health and support, being able to have trained and competent supervisors, be able to extend themselves to care for others, knowing that they have the support of their organisation around them, with the goal of keeping people safe at work, as they would any other risk in their workplace, and trying to leverage improved and increased productivity and reduce absenteeism, presenteeism, turnover, and challenge the stigma that may occur in some workplaces, in some sites, in some times, on some issues. And for your employees, what is the benefit for them? What does success look like for them? Well, they have improved mental health and wellbeing. They have an increased awareness of the support resources that are available to them, both within the organisation and beyond the organisation. They have increased capacity to reach out and support others that they may see could be struggling through no fault of their own. And because they've worked together with their workmates for so long, they may see the issue coming well before the worker does themselves. So providing that mandate and that support and that knowledge to ensure that people are encouraged to seek the help that they need. No one should feel guilty or ashamed for seeking help for mental health issues at any time. let alone these unprecedented times that we find in our workplaces at the moment. They'll receive support to stay at work. They'll receive support to better manage these issues, to contribute to their organisational goals, their team goals, and the support of those at their kitchen table. That's what employers will see if you launch a successful integrated workplace and mental health wellbeing strategy. In wrapping up, what does Aon offer? We offer realistic, achievable and actionable and scalable programs. To conclude, in the past, enterprise-wide psychological risk mitigation, governance and assurance associated with mental health strategy was very much deemed a luxury, but much has changed. In the complex, volatile world in which we all live, delivering an integrated mental health strategy for your people is now more than ever a necessity. If you'd like further information, please head to our Aon's Insight website or our Aon's Mental Health Solutions webpage. And on behalf of Gillian and myself, I thank you for your time in attending today's session. And from all at Aon, stay safe, stay well, and stay caring. Thank you.